Hey everyone, this is WAFB's Lester Dewey. Tuesday will mark 1 year of COVID-19 in Louisiana, and it's safe to say that nobody saw the masks, the shutdown, the economic impact coming, not even the doctors who led Louisiana through the crisis. I spoke with both of them about what a year it's been.
It's sort of a blur, right? Time passes by fast when you're not in a pandemic, and super fast when you are. So sometimes I have to remember what date, when did all this really happen? I remember the first day that we found out we had a case at the lake. That's sort of seared into my memory. But this time last year was still a lot of preparation because we had not heard about the first case in Louisiana yet. We were getting lots of information from Wuhan, lots of information from colleagues that we knew in Italy. We had sent a couple of patient samples and had had a negative so far, but that had given us a lot of good kind of trial runs at what are we going to do and how are we going to do it. And then most importantly, my memories center a lot around what you just said, which was all of those big community meetings. The first time I had ever seen the community get together in that sort of fashion outside of a hurricane. And really, hurricanes, we already have a playbook. So watching the community write a new playbook together is something that I continue to be most proud of a year later.
Well, we knew it was coming and we were paying close attention. The Seattle area had a few cases. Out of that, there were a lot of conversations going on. And I think one of the things that Louisiana does very well is emergency preparedness, and particularly because we unfortunately have so much practice at it. So we had, reviewed our pandemic plans. We actually, made a lot of progress with the Ebola plans a couple of years prior to this. So a lot of reviewing plans, a lot of discussions with local government, with hospital leaders, and talking through what it would look like, when we started getting our first case. I think looking back on it, I don't think we expected how quickly the cases would grow, particularly in the New Orleans area. And people might forget, but there was a couple weeks in the middle of March where the greater New Orleans region actually had the fastest growing outbreak of anywhere in the world to date at that point in time, faster than South Korea, faster than Italy, and faster than even Wuhan, China, where it began. So it definitely spread quick, but there was a lot of preparedness that went on. And I think that had we not done that preparedness, we certainly would have been in a worse spot than we were.
Some key dates sort of in your tenure, even before we got the first case or kind of leading up to that too.
I remember very clearly around New Year's time and the first week of January, hearing about a cluster of 4 cases that were identified in Wuhan, China, that had an unusual pattern of pneumonia. Hearing about those and reading about it, watching the WHO's response. I remember around in February, mid to late February, learning about what was going on in Washington State, and they had some clusters, particularly with nursing homes there. And then on March 9th, we got our first case in Louisiana. And, because COVID time is very strange, March 9th, 2020 feels like yesterday, and it feels like 6 years ago. So things happened very, very quickly after that. We were very, very busy. We came right up to the brink of overwhelming our hospitals. We didn't. We never got to a place where we couldn't provide life-saving care or even normal care. We never had to triage ventilators. We never had to enact crisis standards of care, but we got very, very close, a lot closer than anyone felt comfortable with.
The first memorable date is February 6th, because I have an email to my infection control team saying, hey, can we look at the pandemic plan and just make sure that we like the way it looks. I was traveling that week and I started noticing in the airport more and more people wearing masks, and knew it was coming, although didn't at the same time. I don't think I had a true awareness. February 23rd, Dr. Craig Green showed me the Hopkins map that then we all started looking at. I hadn't seen it before, and I'll not forget looking at it on his phone and then going to my computer to study it, and it really hitting home. March 4th, the day we had the business brief, where we took tons of people, we would never do that today, and put them in a room and talked about what to expect and how to prepare your business. It feels so naive now thinking back about what we were telling people, although a lot of it still rings true, spacing people out and making sure we wash our hands and all of those good things that have kept us healthy. And then March 18th, the day I got the call that we had our first patient in the hospital who had been admitted for several days because results took so long to come back. I think those are all super memorable dates. March 23rd, our first real results from River Road Labs. We knew we had a lab in town now that we had validated, and we moved all of our testing there.
What did we not know back then that we know now a lot more of?
A couple of big things. They're mostly clinical for me, but they put me at ease when I see patients. It is amazing how little the patients who come to the hospital spread disease. We thought we would get this all from the patients we took care of, but we really get it at home. By the time people present, they're usually days to weeks into their illness, and they're not infectious anymore or becoming less infectious. So the real burden of infection was happening in the community. And that's why the stay-at-home order helped so much. It kept the community from moving about. I think just feeling so much more comfortable with how to protect ourselves. We were so scared. It was so new and not understood. And now I don't have any fear of talking to a patient whether I know they have COVID or not, and then seeing a patient with COVID. There's no fear attached to the care of the patients anymore, and that's wonderful because it's not fair to the patient. For anybody to be fearful of caring for them. And so I think the knowledge about the disease is something that we finally feel very comfortable with. I went back and looked at my text messages from the first patient we thought had COVID, the first patient we tested, and looked at, it's just amazing. We're debating, is the PCR a good test? Should we just CT him? I heard in Wuhan that they're CTing everybody. We don't CT everybody. All of this misinformation that's finally been put to rest. And that took a few months to happen.
We were handicapped back then for a couple of main reasons. There was a lot that we didn't know about the virus, and there were resources that we just didn't have. No one in the country had at that point in time. In terms of knowledge, we did not know how significant asymptomatic infection and spread was in the propagation of this virus. We really did not know that at all, because that's not something we see with seasonal influenza. It's not something we see to that degree with other viruses. But now we know that up to about 50% of people who are infected have no symptoms at all and can just as easily spread it to somebody else. That really changes how you go about reducing transmission and stopping the spread. That's why masks became so important. If it was enough to just say when you're sick, stay home, masks probably wouldn't be necessary, but that's not how this virus spreads. We'd love to take that back if we had that knowledge back then, but it took some time to learn that. In terms of resources, we were really hamstrung early on with how little testing was available. And back in those early days in March, even pushing into April a little bit, we had to send tests off to the CDC until we got our own testing capability, which means we had to really triage who got tested. And folks will remember you had to be very sick or even have traveled internationally at that point to be approved by a test. The Office of Public Health had to approve every test, then we had to send it off to the CDC. It took a long time to get back. We missed a lot of cases. By the time that we diagnosed our first case on March 9th, looking back on it now, there's no question there was significant transmission. There was significant transmission during Mardi Gras. Had we known all of that now, or had we known that at the time, we would have been making different decisions. Mardi Gras wouldn't have happened. Any number of events wouldn't have happened had we had the visibility by testing that we wish we had had.
If anything that we would have changed, maybe it would have helped us out in the long run?
I wish there had been less misinformation. I don't regret the mask thing because I think that we will drop the masks at some point, right? If masks kept us healthy all our lives, we'd wear them all of our lives, and we're not going to do that. That masks help in a pandemic in which we don't understand the transmission. Once you understand the transmission, masks are just a part of it, right? Vaccines are the big cure. So I think that if we had just been more, if we had been able to give a consistent message, this is what we know now, this is what we know tomorrow. Hey, now masks are going to be very beneficial until we get a vaccine. I wish that we had been able to do that because it was so hard, and it was an election year, but it was so hard to watch the community fight over science. And if there was anything I could have that I wish would have changed, it would have been that we stopped fighting over science, because the science really never changed. It just advanced, and people weren't accepting of the advance because there wasn't a consistent message.
We are close, as you've been saying, to ending this. But what needs to happen from now until that point to get there?
Yeah, no, we are close, and I really am optimistic about this. I mean, it's not, well, it is cliche, but it's true. We do see the light at the end of the tunnel, and that's nice because it's been an awfully long tunnel. We have about 16% of the state's population vaccinated now, and that's even including kids that aren't even eligible for the vaccine. So that's not herd immunity, but that's not insignificant. That's a really, really good base, and our supply of vaccine is going to continue every week. We're going to get more. So we have to do two things right now. We have to keep transmission down as long as possible to buy us enough time against these variants, because the variants are going to circulate and continue to increase. We've got to buy as much time by keeping transmission down until we have enough vaccine coverage out there to weather what the variants might bring. So we got to be vigilant, do the masking, do the distancing, wash your hands, stay outdoors as much as you can for just a little bit longer so that we keep those variants at bay. At the same time, we have to use every dose of vaccine that comes to us as quickly and equitably as possible. That means for folks in the community, when it's your turn to get vaccinated, when you become eligible, don't waste that opportunity. And I think that means taking time now to have discussions, get your questions answered. I think everyone has questions, and that's normal. I don't want people to waste time once they get eligible. So take the opportunity now to ask your questions, talk to people, talk to your primary care doc, talk to anyone who you respect in this matter, discuss the issues that you're concerned about, get your questions answered, put yourself in a position so that once you do become eligible, you can jump at that opportunity.
We are as close as we can be, but I don't see the finish line yet. I won't see the finish line until I stop hearing people say, I'm never getting that vaccine. The finish line comes when people accept that the vaccine is the end of the pandemic. And I think that we're very close because we've seen the first wave of people who want it, but we vaccinated so few people overall. We'll be close to the finish line when everybody else says, it's my turn and I'm ready. And so I don't see that yet. I see it coming and I hope that it's brewing, but we need the next wave, the 20 to 50-year-olds to say, I also want the vaccine. That's when we reach the finish line. And until then, we have some work to do.
I'm Liz Coe. Thanks for checking out the WAFB YouTube channel. Hey, why don't you subscribe while you're here? Go ahead and click on that box and you'll get the latest updates on when we go live. Make sure you download the WAFB News app for the latest updates too.